Hello, I am Dr. Neha and a very warm welcome to Feminine. Today I am going to talk to you about premenstrual syndrome or PMS. After having understood what is PMS, why it happens, we all want to know how to manage it. So, like for so many other conditions, here also, needless to say that lifestyle has a very major role to play in the management of PMS. Having a healthy lifestyle, doing regular workouts and exercise, keeping an optimum body weight, reducing the levels of your stress by doing daily yoga and meditation, not smoking, all these are the healthy lifestyle factors that one should follow to minimize the symptoms of PMS. Other than that, certain supplements like vitamin B6, that is pyridoxine supplementation, calcium supplementation, vitamin D supplementation can also help to relieve the symptoms to some extent, although there is no 100% proven efficacy of any of these supplements. Those who have predominantly breast tenderness before every period, they may be helped with the evening primrose oil or the Primose, which your gynecologist will very commonly prescribe you if you go to them with these kind of symptoms. Now, as I have already mentioned that the PMS happens because of the fluctuations in the hormone levels in the body, and the mainstay of medically managing this condition is to suppress the function of the ovaries so that the ovary stops producing hormones, and then that will lead to a betterment in the symptoms of PMS. So how do we do that? The most commonly used medication to do that are the birth control pills. Birth control pills, they are usually normally given cyclically, but here to suppress the function of the ovary, we may give them continuously. So like 3 packs to be taken continuously back to back without giving any break in between. By doing that, we will be suppressing the ovarian function, and that will largely help to manage the symptoms of PMS. Also, if the emotional symptoms or the psychiatric symptoms are having a predominance, then we may need the input of our psychiatric colleagues as well to manage the condition. Very commonly, there are certain classes of drugs, typically antidepressants like the citalopram and escitalopram, which may be prescribed, and they help to manage a lot of emotional symptoms of PMS. A very small chunk, however, will be there who may have such severe symptoms that are not controlled by any of the measures that have already been spoken about. So what to do about them? One option is to give certain injections. So these injections, they cause a complete cessation of the fluctuation of hormone levels in the body, and that is how they help to manage the symptoms of PMS. And of course, as a last resort, if somebody has already completed her family and they are more than 40 years of age and the symptoms of PMS are so severe that it has become a complete stop in the daily routine activities, then surgical management is the last resort with us. When we do surgical management, we do a removal of the uterus along with the removal of both the ovaries. Only that will help to control the symptoms of PMS. Leaving the ovaries behind and removing only the uterus is not the solution for PMS. However, if the female is younger, if she is less than 45 years of age, then after surgery, after the removal of the ovaries and the uterus, there may be a requirement of some low dose hormone replacement therapy to take care of her bone health. So that was all about PMS today. I hope you've liked the video. If you found it informative, please do share it as well, and I'll get back to you soon.